And welcome to the Dr. Bob Show. I've always been fascinated with neurosurgery, with brain surgery, and the skill of the neurosurgeon as he involves himself with the brain. We'll be spending most of this show talking about a gamma knife, a special knife that's used in neurosurgery to help excise and take out lesions in the brain. My guest is Dr. David Hauge. Dr. Hauge is a board-certified neurosurgeon. He'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about why do so many people get high blood pressure and what can we do about it? And diabetes, elevated blood sugar, why does it cause problems with small blood vessels leading to kidney problems and nourishment of the extremities? A lot of information for you. You'll want to stay tuned. We're talking with Dr. David Hauge, board-certified neurosurgeon, medical director of the Gamma Knife Center at Thompson Cancer Center. David, welcome to the Dr. Bob Show.
Thank you, Bob. Glad to be here.
Tell me, what training does a neurosurgeon require, and what was your training?
My training was 4 years of college at the College of Worcester in Worcester, Ohio, where I got a biology degree. I got a master's degree in neurobiology at St. Louis University School of Medicine. I got my MD degree from West Virginia University, where I'm from, in Morgantown, West Virginia. And I did my neurosurgery training at hospitals and clinics of the Medical College of Georgia in Augusta, Georgia.
So you've had an extensive training. Tell me about what is a gamma knife? I'm not sure what a gamma knife is.
Okay. A gamma knife is a device that was invented in Stockholm by the late Dr. Lars Leksell, a very famous neurosurgeon. It's a radiation device used to treat tumors and other disorders in the brain that traditionally were treated with open surgery. He wanted a simpler, safer, easier way to treat these things with less risk for the patient and hopefully more effectiveness. So he referred to it as a knife because it was taking the place of his knife. He was a neurosurgeon, and so he came up with this device called a gamma knife, but it's not really a knife.
So you don't have to open up the skull or anything. You've really got what? What is it? What's doing it?
What you can think of gamma knife as doing is basically a magnifying glass for radiation, focusing on very relatively small areas of the brain while sparing the surrounding areas from the effects of radiation. Kind of like when you were a kid and you took a magnifying glass and burnt paper.
Yeah, and that was great fun to try and see how hot you could get that little beam.
Yes.
So you're doing that at the brain.
Yes.
What type of lesions do you work on in the brain? Are these tumors, primary tumors, or spread tumors, or what?
We do all sorts of tumors. We do both benign and malignant tumors. About 60 to 70% of what we do are metastatic tumors that have come from, say, breast cancer, lung cancer, kidney cancer, ovarian cancer. The remainder of the tumors that we treat are mostly benign tumors such as meningiomas, which are tumors of the coverings of the brain, acoustic tumors, which can affect hearing and balance. We will treat pituitary tumors, usually after they've been operated on, but occasionally as a primary treatment. We also treat disorders like trigeminal neuralgia, glossopharyngeal neuralgia, which are irritations of cranial nerves, which cause quite a bit of pain in the face and or throat.
So there's a wide variety of things that you can use the gamma knife. Let's go back to basics. What is a metastatic tumor? Metastatic means what?
Metastatic means that it is spread from a source outside the brain, such as breast cancer has a very high rate of spread to the brain. Lung cancer, people get a lung cancer from, say, smoking. That tumor can spread ultimately to the brain through the blood supply, through the blood system, the vascular system, and lodge in there and develop into multiple tumors.
So when you've got tumors in the brain, what is the team? How are things formed to get rid of that tumor with a gamma knife? Special procedure?
Yes, it's a very special procedure. The patient's usually referred by their medical oncologist or radiation oncologist. They'll be referred to our center. We have a conference every 2 weeks where we review all the cases before they're treated to make sure they're appropriate. And then we have a team of a neurosurgeon, a radiation oncologist, and a radiation physicist. All three of us have to be together to perform this procedure.
So let's go through those three again, those three people.
A
Neurosurgeon,
radiation oncologist,
radiation oncologist, cancer doctor, radiation.
yes, and the radiation physicist, who's usually a PhD in radiation physics. His responsibility is to make sure that the machine is working properly, and he will generally be involved significantly in the actual dose planning on the day of the procedure.
So if one of my friends had a lung cancer, it had spread to the brain, there were 4 different lesions in there. Do you have to go in 4 different times? How do you decide if you can excise those with a gamma knife?
Well, we're not really excising them. We're treating them to get them to shrivel up is what we want to do, get them to shrink up and hopefully get smaller and go away. Basically, we can treat anything up to about 3 to 4 centimeters, which would be about like this.
So,
yeah. Beyond that, the dose of radiation that is given can be a little harmful to the brain. And generally, those people are having symptoms where sometimes they might need an open operation. But we can treat up to 10 to 15 tumors at a single setting over 2 to 3 hours.
10 or 15 at one setting.
Yes,
so how often will you see more than 5 or 6?
Quite frequently.
Quite frequently?
Yes.
And so you can melt these away.
Yes.
What does that do to somebody's longevity? They've got a primary cancer of the lung or of the breast, and it's spread to the brain. You take the brain out, but you know, what does that do to extend somebody's life?
Well, if someone comes in with, say, a breast cancer, and they have multiple tumors in their head from their breast cancer, without treatment, they will generally not live more than 3 to maybe 4 or 5 months. With gamma knife, we can treat these tumors without putting the patient to sleep, without opening up their head, without exposing them to any of the normal risks of open brain surgery. They go home the same day. They can go back to work, their activities the next day. If we don't treat them, they're not going to survive this.
That's what I call in East Tennessee nigh unto amazing.
It is amazing.
You know, that they can do it. It must be very thrilling to do that. How do you prepare the patient for it? Now, so let's talk about, you've got a gamma knife center.
Yes.
And you've got the 3 people,
Yes.
Or the 3 heads there. How do you organize targeting lesions in the brain?
Well, what we do, the patient comes in, is admitted. We attach a box to the skull under local anesthesia called a stereotactic frame. And that's usually just a bit of pressure. It's usually not very painful. We will then take them to the MRI scanner or the CAT scanner and do a scan with the frame on. This gives us a set of mathematical coordinates, kind of like looking at a grid map, but only in 3 dimensions. And then we can basically target, using those mathematical coordinates, target the radiation beams onto the various tumors.
And you can target all 4 or 5 or 10 of those lesions that are there.
Yes, sir.
When you do the radiation, how long do you push a button? It lasts so long. How long do you know how to put the gamma rays on the target?
Okay. The software in the gamma knife, which has been developed over 40 years, basically is based upon the strength of the cobalt sources on that day and the size of the tumor and the dose that the radiation oncologist knows is going to be effective for that tumor. So it will be a function of size, number of tumors, the strength of your cobalt sources, and particularly, are you near any important structures like the brainstem or the optic chiasm? Because sometimes we have to cut the dose a little bit to protect those vital neurological structures of the brain.
As you're getting to the target area, you have to go through some viable brain. Does the radiation bother that part, or it just sneaks through because of like the magnifying glass?
That's exactly it, Bob. Each beam, there's about 196 beams. They all come in from different angles all around the brain. So if my fist is the brain, is the tumor, and out here is the brain, the beams are all focused to maximize to intersect at this one spot with a very rapid drop-off outside the tumor, so we're sparing the surrounding brain from as much radiation damage as possible.
If you've got a lesion that's maybe 2 centimeters, not 3, and you use the gamma therapy and the patient goes home, is there not any edema, some swelling of the brain around where you did that, where somebody feels poorly for a couple of days?
They can, but interestingly, that generally doesn't happen for about 6 to 8 weeks. And the radiation planning has been so refined over 40 to 50 years of gamma knife treatment that we know exactly how much radiation we can give safely. So the patients that you run into with radiation swelling are generally the people with a little larger tumors. Some people are just going to be more genetically prone to develop edema, but even if they get edema, we can generally treat them with steroid pills, and the vast majority of them will do just fine.
You mentioned earlier that there were other lesions other than metastatic tumors that you can treat with this. Name me one or two.
One of the most common things we will treat will be trigeminal neuralgia.
And that's what we're going to be talking about when we come back. Trigeminal neuralgia, what's that? I can tell you one thing, it's a very painful problem. We'll be learning about that and how the gamma knife can take care of it. We're talking with Dr. David Hauge, board-certified neurosurgeon, medical director of the Gamma Knife Center at Thompson Cancer Center in Knoxville, Tennessee. David, we've been talking about the gamma knife. How good is it?
Okay. The gamma knife was the first radiosurgical device devised to treat problems in the brain. It is, over the last 60 years, has become the standard of care for cranial radiosurgery. There are over 6,000 peer-reviewed articles on gamma knife radiosurgery.
Is it the gold standard?
It is the gold standard.
Anything compare with it?
As far as accuracy, no. It is the most accurate radiosurgical system in the world.
Are there different gamma knives? Are there different companies that make different gamma knives?
Gamma knife is a registered trademark of the device that we use. There are other devices that do cranial radiosurgery, and they also have devices that do radiosurgery outside the brain, such as in the spinal column, or even in other areas of the lung or other areas of the body. But as far as cranial radiosurgery, which is what gamma knife does exclusively, it is the most accurate and best documented system in the world.
I just find that just so exciting. I'm jumping up and down in my chair right here. Tell me about the other uses other than metastatic brain cancers. What are some of the things that metastatic tumors from other areas? What are some other brain lesions that you work on?
Okay. Well, certainly there are other types of tumors. One of the most common things that we treat is trigeminal neuralgia.
Now, what is trigeminal neuralgia?
Trigeminal neuralgia is an inflammation or irritation of the trigeminal nerve, which supplies sensation to the face.
So that's the fifth cranial nerve.
Yes.
It supplies sensation to the, and if it's causing neuralgia, that's pain.
It's extremely painful.
How painful?
It can be so painful that occasionally people will commit suicide if they don't get good treatment.
And the pain is usually it's always in the face there,
yes,
where the trigeminal nerve covers. So what do you do to attack it? Same thing as a brain tumor in the brain?
Right, and there are multiple ways you could treat trigeminal neuralgia. Sometimes they do open surgery on the nerve, but gamma knife radiosurgery allows us to focus a very small beam of radiation onto the trigeminal nerve as it comes out of the brainstem and goes out towards the face. By disrupting the normal pattern of nerve impulses in the trigeminal nerve, we can treat the pain that is occurring.
Is it easy to find the trigeminal nerve where it comes out of the brain?
Yes, it's usually very apparent on an MRI scan. It's very easy to see. It's a very large nerve, and you can see it quite easily on an MRI scan.
How effective in treating trigeminal neuralgia is the gamma knife?
At least 85% of patients over 3 to 5 years will report very satisfactory relief. Trigeminal neuralgia, whether it's treated with open surgery or medications or gamma knife, does have the tendency to recur, and we can treat people up to 3 times.
Wow. As I think back of seeing patients in my medical practice, I used to see people with trigeminal neuralgia, and I don't see them as much anymore. I anticipate it's because they've been treated with the gamma knife, and it makes it go away.
It does an excellent control. We always have to watch the patient because there is a chance it can recur, but they can be retreated.
Let's go from the fifth cranial nerve to the eighth cranial nerve. That's the hearing nerve.
Yes.
There is a tumor of the hearing nerve. What's that called?
These are called acoustic neuromas.
So acoustic neuroma,
yes,
the symptoms of that are frequently what?
Generally, the patient will show up at their doctor's office and they've developed ringing in their ear, or suddenly they've had a sudden unexplained hearing loss.
So hearing loss, ringing in the ears, and the workup they find that they've got a tumor in the eighth nerve.
Yes, the ear, nose, and throat doctors are very good at becoming suspicious of whether they need to get an MRI on these patients or not. So you get an MRI, and that makes the diagnosis very easily.
So they then say, I've found out what it is, now I'm going to send them to a real doctor to take care of it?
Well, they're all real doctors, Bob.
I was just teasing because my son is an ear, nose, and throat
And I'll be
doctor.
sure to tell them that next time I see him. Okay.
So is there anything different in treating an acoustic neuroma with trigeminal neuralgia?
Okay. The basic procedure is the same. The dose planning is different because every acoustic tumor will be a little bit different in size and shape. We again have to make sure that we're not giving too much radiation to the brainstem,
Sure.
just like with trigeminal neuralgia. We know exactly over the last 50 years from all the literature that's been published on acoustic neuromas exactly how much radiation we need to give the tumor to get it to stop growing and hopefully to shrink, at the same time protecting the function of both the seventh and the eighth nerves.
What kind of stories do you get from patients that are having pain and they're having hearing loss and they're having ringing in their ears, and you take care of the problem with this? What kind of gratification? It's just making me thrilled to hear this.
I mean, it's been one of the most rewarding things that I've done in my career. You can't imagine the gratitude that someone has with trigeminal neuralgia when their pain has been so bad they've been barely able to talk or to eat or to drink or to touch their face just to shave or put their makeup on. And some of these people are better within 2 weeks after treatment.
That's absolutely amazing. Let's go back to the brain. What other lesions? You mentioned meningioma.
Yes.
Sometimes. What's a meningioma?
Meningiomas are usually benign tumors of the coverings of the brain. They grow very slowly. They tend to occur more in women in the postmenopausal years, but they can occur in men or women of any age. They're frequently discovered because someone has a scan for some other reason. They can become quite large before they become symptomatic.
And how do you attack that if it's a large one? Okay. Does it have a size barrier?
Yes, again, we get to around 3 to 4 centimeters, and particularly if the patient's having a neurological problem, say like weakness on one side, we'll recommend removing it. But if you run into a tumor that is of 3 centimeters or so or less, then you can safely treat that with Gamma Knife. And to keep it from growing and hopefully get it to shrink down. But the key is you don't want it to get any larger, so you spare the patient an operation in the future. Because if they live long enough, it will get big enough, it will cause them symptoms.
So are there any brain tumors that the Gamma Knife, you have to stay away from these? How about glioblastoma that's got little fingers that go out?
Glioblastoma is the most malignant of all brain tumors, the one that scares the most people.
Yeah.
The initial treatment for glioblastoma is generally open surgery to reduce the volume. Then they'll generally get whole brain radiation, where the whole brain gets irradiated,
wow,
plus chemotherapy. But we do boost treatments to areas of glioblastoma after they've had these other conventional treatments, and sometimes this can add a good bit of time on to the lifespan of these people.
You're at the Gamma Knife Center is at the Thompson Cancer Center. Do you have cancer doctors from all over send their patients, or it's just from a certain practice?
No, we have currently 6 neurosurgeons practicing at various hospitals all over town. We have 5 radiation oncologists participating from various hospitals all over town. And any of those doctors can bring their patient for Gamma Knife treatment.
Is for a town the size of Knoxville, is that a lot of neurosurgeons, or is that a small amount? How do we provide services to the amount of people that have problems?
We have a wonderful access for Gamma Knife with the number of people we have and the number of stereotactic frames that we have. We have 6 frames, so we could treat 6 people a day if we need to. We've got a wonderful support from Covenant Health with their imaging departments and our nursing department and our administrative departments. So it's really a team sport, if you will. Gamma Knife is, if one person doesn't show up one day, whether it's the nurse or the neurosurgeon or the radiation doctor or the radiation physicist, the patient's not going to get treated because everyone has to be there.
Yeah. It's a wonderful, wonderful, wonderful thing that you can do to help these people that have such a devastating problem. David Hauge, you're a wonderful teacher. Thank you so much for coming to the Dr. Bob Show. It's been absolutely fabulous for me to learn about the Gamma Knife and what it can do.
My pleasure.
Wow. Know that no matter what goes on, the advances that we have in medicine and advances like Gamma Knife can treat lesions in the brain, that we couldn't do a long time ago. I want to thank Dr. Hauge for his wonderful discussion. And now we're going to want to stay tuned. We're going to be talking about why do so many people have high blood pressure and diabetes. What part of diabetes causes problems that make us have kidney failure and amputations and blindness? A lot of information for you. I want to thank Dr. David Hauge. Wonderful discussion on the gamma knife therapy. And now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, why do so many people have hypertension, high blood pressure? Well, it's a very interesting problem, but as we get older, frequently our blood vessels become a little bit more firm, a little harder, a little hardening of the arteries, a little bit of cholesterol deposition, a little bit of hardening of the arteries. That means the heart has to push the blood through harder, and that has to give a higher blood pressure. If you live past the age of 65, your chances of getting hypertension, high blood pressure, are some 90%. So it's a very common thing for people to get. There are rare causes of high blood pressure, but most are called benign essential hypertension. That simply means that you've got high blood pressure. We don't really know the cause, but it's the way the blood vessels are adapting. Now, when we have high blood pressure, it can cause other medical problems. It increases the incidence of stroke. We have to know what our cholesterol is so that we can help those blood vessels become less hardened. So we have to know what our cholesterol is. We have to know what the LDL is, the bad cholesterol, because that's what deposits in the blood vessels to make them hard, that makes the blood pressure go up. And the HDL, the high density lipoprotein, the good cholesterol, we have a hard time getting it up. It's like a garbage truck. It comes around and it takes some of the cholesterol out of the blood vessel. So we want more HDL and we want to get the LDL lower or better. Now, there are lots of excellent medications for high blood pressure. The best thing you can do is exercise on a regular basis. Cut down on your salt on a regular basis. If you'll do those things, you'll find your blood pressure will go down. And then there are medications, diuretics, that get rid of sodium. You have to watch your potassium on that. You have to work it out with your doctor. And then there are other medicines, calcium channel blockers, beta blockers, alpha blockers, other medicines that we can use to lower the blood pressure so that your high blood pressure won't cause other medical problems. Be sure that every time you go to the doctor that your blood pressure is taken. If your blood pressure is high, get a blood pressure cuff for home. Measure your own blood pressure. Record those so that you can take them to your doctor and say, here's what my blood pressure has been at home. Question number two. Dr. Bob, my doctor says I have diabetes, but I don't have to take insulin. Do I really need to worry about it? Well, everybody has blood sugar in the bloodstream. We have to have insulin that puts the blood sugar, the glucose, into the cells for energy. So it's an insulin problem with diabetes. With type 2 diabetes, there's an insulin resistance. So the insulin's there, it just doesn't work on the blood sugar. So when it doesn't work on the blood sugar gets higher and higher and higher, and we begin to spill glucose in the urine. Now, for some reason, we don't know why, but diabetes begins to affect the small blood vessels, not the big ones, but the small ones. And it can lead eventually to blindness. We can have lack of nourishment of the extremities, and we can have to have amputation. We have to really take good care of our feet if we have diabetes. It can lead to kidney failure because the small vessels that nourish the kidneys are not working because of the diabetes. And it also affects the coronary vessels in the heart. So we have to be very, very careful that when we've got diabetes, that we control it. So you have to work out that problem with your doctor. There are good medications for type 2 diabetes that will help lower the blood sugar without having to use insulin. So know that there's medicines, there's things that you can do, but it's a wake-up call. When your doctor says your blood sugar is high, you have to start paying attention and improve your health. It's all the time that we have for this show. Remember, exercise, it'll lower your blood sugar, Know that exercise will help your hypertension. Know that exercise is one of the best things you can do to control weight. So make exercise a regular part of your life. 7.5 to 8 hours of sleep, you'll be rested, you'll perform better, you won't get behind. Know that sleep is very important to your health and to the health of those that are around you. Because when you get good night's sleep, you're happier. And when you're happier, people around you are happier. So know that sleep is an important part of the health of your life. Eat properly. When you have breakfast, you can have cereal with skim milk or no-fat milk. Put some fruits on it, put some berries on it, slice some bananas. Make your cereal fruit and fiber. That will help your health. And then as we go on the day, watch out what we eat. You know, we think of a salad as something that would be non-fattening, but then we put lots of things in the salad and salad dressing. Look at the calories of salad dressing sometimes. They can be astronomical. And then in the evening, when you eat meat, it should be less than the size of a deck of cards. So that's a small amount. So be sure that we watch the portions that we eat. Don't be a nighttime snacker, because a nighttime snacker is one who will gain weight. Most of all, what do we want in the Dr. Bob Show? It's laughter in your life. Have a great time laughing. Find that person that you love. Laugh a lot, giggle a lot, and you will stay healthier.